is just repeal Obamacare. What is your solution to healthcare dilemma?
Well, I too am for repealing Obamacare because it is an approach. Remember we talked about earlier the difference between Europe and the United States. In Europe, they feel comfortable with government top-down, telling people how to run their lives and what to do, what health insurance you're going to buy, how much you're going to pay for it, what the policy is going to look like, who the providers you can go see. All of that is very prescriptive and from the government down. And it is the exact opposite of what made America the greatest country in the history of the world. What made America the greatest country in the history of the world was that we believed in bottom-up. We believed in limited government, free people using that freedom to pursue their dreams, allowing people to succeed greatly. And it was okay to succeed greatly in America. If you succeeded greatly, we built statues at the town square for you. We didn't go around and rail against you for being millionaires and billionaires and say you're bad people.
Yeah.
Because a lot of those people that succeeded greatly have plowed much back into these communities and everywhere else across America. And we allowed people to fail. And failure was not seen as, the worst thing that happened to you, that it was part of life, which it is. I've had my share of failures. I've won elections, I've lost elections. I like winning more than losing, but I can tell you that by losing, you learn things. We all have. I mean, the old idea that you learn more from your failures than you do from your successes is not just an old adage, it's true. And yet, we have a society that tries to insulate, or a government with increasingly so in Washington, tries to insulate people from failure. And somehow or another, the government can protect people from failure and suffering and all this, but it's just part of life. And so experiencing that, and I got criticized, I mentioned this the other day, and the blogs lit up and Twitter lit up, santorum's for people suffering. Well, not for people suffering, but people suffer. Whether you try to stop it or not, people do suffer, people do fail, and that's part of life. And the idea that it's government's role to stop suffering or stop failure, I mean, where did that come from? I mean, you show me where that ever worked. What's important is that we create a society where people have the opportunity to learn from that failure, to learn from that struggle, and be able to rise and succeed. That's the key. That the ladder's there to still climb up if you're willing to work hard and do the things that are necessary for people to be able to provide for themselves. And so it is with healthcare, that we have a system of healthcare in America, like I said, which right now is very prescriptive and very top-down. And it's going to be managed by the federal government. And that means that the government is going to decide your access to care. There's not an infinite amount of money. The federal government can't give you a card and say, here, spend whatever you want. They've done that in Europe, and look at what's going on in Europe. It's crashing and burning. They're rationing care like all over the place. And it's going to be rationed on the basis of what the government thinks is the best use of their money. Which means if you're older, which means if you're chronically ill, which means if you're a disabled child, just not a good use of our money because there's limited resources. So the government's going to make the call. And it won't make the call by saying, no, we're not going to cover you. It'll just make the call by saying, no, you wait 6 months for an appointment because you're in such an order, you're in such a queue, right? As opposed to somebody who's a young, healthy worker who got sick, well, we'll put you up in front. We'll take care of you. And that's the reality. That's what happens. And I think that is against every value that America stands for. And so how do we change that? We put the resources, instead of in the government, we put them in your hands. And we give you the responsibility, because the issue here is, how do we control costs? The American economy, almost 18% of the American economy is spent on healthcare. The next highest, I think, is Norway or Denmark, which is 12. And we have the best healthcare system in the world as far as medical care. We have a lousy health insurance system, right? A lousy health insurance system. But we got a great healthcare system. Nobody can say that you go into a hospital in America and you don't get the best care in the world. We do. People come from all over the world. They come to our medical system here. The problem is we don't have a system, a health system that efficiently spends that money. So what are we going to do? We're going to give it to government to officially spend it. Anybody believe the government efficiently spends anything? Yet we want to give them 18% of our economy? How ridiculous does that sound? How about giving that 18% of the economy back to the people? Let you be the consumers. One of the big problems in healthcare, ladies and gentlemen, is that you've been insulated from the cost of healthcare. You have no idea what your healthcare costs. You have no idea how much an x-ray is. You have no idea how much a doctor visit really is. Oh yeah, you pay your $10, $15, $20 copay, but what does it really cost? What's this other diagnostic test that you're giving or other procedures? You don't know. And then you wonder, gee, why do we spend so much money on healthcare? Because the people consuming the service have no idea how much it costs, and they don't care. Imagine if you came in here and you had insurance, and you could just go and order whatever you wanted. It'd be great for their business, right? They'd have tons of business if you could buy 20 cups of coffee, buy them for your friends, and you only had a co-payment, right? But we would have an overutilization of coffee. We'd have a bunch of wired people running around Waterloo, right? But that's what we have. We have an overutilization of the system because there's a desensitization from the value of the service to the cost of it. And so how do we fix that? We go back to what a insurance system should look like. How many people here have auto insurance? Hey, everybody, it's Iowa. Everybody drives a car now. How many in your auto insurance does your insurance pay for filling up gas in your tank? How many pay for oil changes? New brakes? That's a repair. New tires? That's a repair, right? If you get a little nick on your windshield, I have to call Safe Light or whatever. How many pay for the nick on the windshield? None. You wouldn't even turn it in. You'd be afraid to turn it in. My insurance might go up. You have little fender benders that cost a few $100, and you just, you know what? I'm not going to tell my insurance company because they'll raise my rate. But you have a cold, and you go to the doctor. Here's my insurance card. Here's my insurance card. No wonder health insurance is so expensive. They're paying for things that aren't insurable events. Insurance is for what? Why do we buy insurance? On anything. Yeah, for the catastrophe, for the accident, for the catastrophic event. But in healthcare, we don't. We pay for everything with our insurance. It's hugely inefficient. It's very costly. And it insulates you from the cost of the care. So what we need to go back is we need to empower consumers. We need to change the insurance model to where insurance is truly insurance. And guess what? If you had a $500 or $1,000 deductible, which is not unusual today, and you change that to a $5,000 deductible, what do you think will happen to the cost of your insurance? It's going to go way down. Now, the plan I put together way back in 1992 was a system called, we call it medical savings accounts or health savings account. Anybody familiar with health savings accounts or have one? That's the future of health insurance in America, which is high deductible policies to take care of people when they need it, when it's going to bankrupt them to get to their health care is going to bankrupt them, but have $5,000 is a lot of money for a lot of people, but it's not like you have it all on your own because if you have employer provided insurance and they go from a $500 or $1,000 deductible to $5,000 deductible, the cost of the insurance goes down, and the way health savings accounts work is the savings is passed on to the employee in tax-free payments to a bank account that you get a debit card for, and then you can use those insurance savings to pay towards your deductible. And most, if not all, health savings account plans, insurance plans, pay for all of your wellness care. The insurance company actually will pay for them. You don't have to pay for them out of pocket. Why do they do that? Because they want to keep you healthy. Why? Because they have less premium dollars coming. And so they're willing to spend a few premium dollars so you get good preventative care and incentivized to get that care so you don't get sick and end up using the insurance. So they have an incentive to keep you healthy, right? It's like auto insurance paying for your oil changes because it's going to keep your car in better shape, right? They don't do that because most auto insurance is used for accidents, not because the car wears out. but you wear out. And that's when you start costing the insurance company money, so they want to keep your engine healthy. So they're going to pay for the oil changes. Makes sense. If that's what happened with auto insurance, that if you had a major engine overhaul, the insurance would pay, well, they pay for your oil changes too, right? So that's the system that we have to go to, and it's believing in American consumers, bottom up, instead of believing in government bureaucrats, top down.